As critically ill patients fight infectious insults, there is often an excessive response that results in the syndrome of severe sepsis. Clinically, you may see increases in temperature, heart rate, respiratory rate, and abnormalities of white blood cell count or differential. As the disease progresses, blood pressure may drop with organ hypoperfusion, and organ systems such as the respiratory, cardiovascular, hepatic, central nervous, and renal system may fail. Traditionally, this excessive response has been associated with the disruption of homeostasis through an uncontrolled cascade of inflammation, coagulation, and impaired fibrinolysis. Deeper examination shows that the microcirculation is the key focus of sepsis injury. The sepsis cascade begins with the activation of the capillary endothelium in response to an infectious agent or toxin. This endothelial damage exacerbates the inflammatory process, resulting in neutrophil activation and expression of adhesion molecules. Neutrophils begin to roll in the capillary and adhere to the endothelium. The increased endothelial permeability leads to a loss of vascular integrity and consequent microvascular leakage. In the lungs, this interstitial and alveolar edema leads to acute lung injury and acute respiratory distress syndrome. Concomitantly, coagulopathy and impaired fibrinolysis prevent red blood cells from delivering oxygen to the organs, resulting in inadequate perfusion and global tissue hypoxia. The amplification of the coagulation pathway results in large amounts of thrombin formation, which converts fibrinogen to fibrin. Fibrin threads with activated platelets form a clump at the site of endothelial activation. Reduced arterial vascular tone, diminished venous return, and the release of myocardial depressant factors lead to hypotension. This is a scan of the capillary circulation in a normal patient. Note the rapid blood flow and numerous capillary loops. Now you see a patient in septic shock despite restoration of normal hemodynamic parameters through treatment with fluids and vasopressors. Note the poor blood flow and capillary loops with intermittent or occluded flow. The depressed myocardial function, widespread tissue ischemia, and multiple organ dysfunction often lead to patient death.